Honor. Right. Hi, I'm Dr. Kabilan, one of the surgical MO in surgical department in UCGS. Okay, so today we'll be performing talc pleurodesis for our patient. Patient is a 73 years old lady. Was diagnosed with invasive breast CA. She came in to us complicated with malignant pleural effusion. She came in to us with a complaining of shortness of breath for past 2 months, worsening. On an X-ray, we noted there is a pleural effusion. So we have admitted the patient. We have drained the initially we drained the fluids under needle thoracosynthesis under controlled environment. Then proceeded with a pigtail incision for this patient, right pleural pigtail incision. And after 3 days, once the drain output become about less than 200, we plan to proceed with the talc pleurodesis. Procedure was explained to patient. And options of fluorescent agents were given. The bleomycin and talc. Patient was keen for talc. Okay. So today, we on our preparation, we first will give the patient pre-medication, IV morphine 2 mg and IV midazolam as appropriately. Maximum dose is 5 mg. We will give about 2 mg initially for this patient. If required, we increase the dose. Okay. Since once the pre-medication was given, we must ensure the checklists are fulfilled. The checklists are: number 1, the lens score is less than 5. Patient's lens score is 3, so she is moderate risk. We still can proceed with pleurodesis because the survival is expected to be more than 3 months. Okay, the second one is radiological confirmation of the pleural fluid evacuation and lung re-expansion. This is the X-ray you are saying is the first X-ray when she first came in, and then followed by the latest X-ray was taken today, showing lung re-expansion. Over the right side, you can see the lung re-expansion. Okay, and also we must mention the pleural drain is functioning, and there is another checklist we can follow, but it turned out to be less relevant in the later studies, which is mentioning that the drain fluid should be less than 150 in 24 hours. Okay, all right. So once all the checklists are fulfilled, we show our preparation list. Okay, so the procedure should be performed under aseptic manner. So this is our talc, sterile talc, 4 gram, and then we prepared our normal saline to mix with the sterile drug and our lidocaine. We will use the full vial of the lidocaine and normal saline for flush. So first I'm gonna show you all how to prepare the talc. The talc should be prepared as a slurry as possible. Do not cause any bubbling or any sedimentation prior insertion to the patient. So I'll be inserting 50 cc of normal saline into the solution. I inserted careful enough to not cause any bubbling or slurriness bubbling into all the sedimentation. Mix it slowly. Then I will take 25 cc of normal saline. Then in each 50 cc syringe, we will take 25 cc of talc. The aim is to not cause bubbling or sedimentation in the preparation, the 50 cc. Right, so since it's advisable to leave at least 10 cc for you to prepare the slurriness later, so do not cause the sedimentation. So next we will clean up the area prior to ensure the aseptic manner. First, we will prime patient with the lidocaine. Make sure the bung, the three-way bung, is close towards the patient prior removal. So you can ask the assistant to hold like this. connect our lidocaine and open towards the patient and prime patient with the lidocaine. Then make sure it's closed. Just wait for 1 or 2 minutes. Once we are confident that we have primed the patient, make sure the slurriness is there. Remove the air. Open the port towards the patient. And admission towards the patient. Close the bone towards the patient. Then we proceed with the second one. Make sure it's as slurry as possible. And remove the air. Connect it. And open towards the patient. And close the port towards the patient. Then we can connect the port. Make sure the port towards the drain is closed at least for 1 hour. And finally, I would like to end it by flushing the normal saline. As I mentioned before this, make sure the port towards the patient, towards the drain, is closed for at least for 1 hour. Alright, that's how the Talc Preparation will be performed. Thank you.